Hey guys, welcome back to another episode of my little pet project where I talk to people who are impacted by COVID-19 that I know. We've explored different topics. This week I'm speaking to health and technology amid the COVID pandemic, and I am speaking to my dad who actually works in technology for a healthcare organization in the Chicagoland area. Obviously, so many industries have to kind of rapidly respond and react and adapt to stay alive during COVID-19, and the healthcare industry has had it the hardest from being slammed with a brand new set of patients while also trying to juggle, handling regular patients who just need checkups and, regular ER visits, things like that. So on this episode, I speak to my dad about how his organization is adapting to these changes. Some of the biggest challenges of, you have patients who need to come in for care but are very fearful. But we also talk about the future. We hear all the time that things are never going to be the same after, this COVID pandemic. And I think healthcare is one of those industries that is going to see some big changes. And so he talks about how COVID-19 actually could bring some benefits to the healthcare industry and how he anticipates changes going forward after, we're forced to adapt in these circumstances. So here's what he has to say.
With the current situation, people are afraid to leave their house and go to a place where potentially, they may be, picking up the virus. So definitely, people are having to put that off till when, we don't know. But, there's a lot of patients out there now that they need to, it's been 3 weeks, going on 4 weeks now, that they need to be able to talk to their physician. So it's been very challenging. We look at total percentage of patients that we're seeing via telemed. A year ago was maybe about 5% of what we did. Over the past 3 weeks, it's close to 35% of how patients, are talking to physicians.
And we talk about we're never going to go back to normal. Some things are going to stick. Do you think when it comes to healthcare and technology and the things that we're adapting this last month might be some of those things that stay around? Will telehealth become more prevalent as we go forward?
Yeah, I know it well. I say that with a lot of confidence because if you start thinking about, when you do need to see a doctor, you need to pick up a phone and you need to schedule, something, and you got to determine if you're going to take time off of work. Then you got to take that time off. You got to, drive to a clinic. You think about that, the 5 to 15 minutes with the physician. You've invested probably 10 times that amount of time, for that. A lot of times that conversation with the physician, it's like, well, why can't I do that, on my break? Why can't I do it, after work or, all I'm doing, from my house or, from a break room or in my car? That I think people are going to get more comfortable with the technology because they were forced to, but they're going to say, why not? Why can't I do it this way so I don't have to take that time off? I don't have to invest all this time, for that visit when I really just need, 15 minutes of their time.
We talked about probably the future implementation of telehealth going forward after this whole pandemic. Is there any other things in the way that you see either how facilities deliver care or how patients receive it changing in the future?
It's difficult to say. I do think the video visits, the consults that do occur, I think, we're going to get away from that 5% and we're probably going to be in that 20-25%. It's never going to go back to the way it was. With, healthcare, it does need to be more efficient. We need to be leveraging, technology. And not just the technology from a healthcare organization. We see it with personal computing devices of, whether you can have a watch that can monitor your heart rate. There is equipment as stepping on a scale. A lot of things that you do when you first come in to see your physician, all those things that they're doing, all that stuff actually could be done every day for a patient at home. Definitely see a lot of things changing where, the technology is going to play a bigger role in healthcare, and it's going to help drive down the costs. And I think it's definitely going to make, people healthier. It's been a lot of kind of reacting to things. And it's probably the biggest challenge, has been, the fact that, patients, aren't comfortable in coming in. And haven't, as I had mentioned, there have been situations where we've been having to do the furlough or laying people off. So, that's been, challenging for us. I think we need to find a way when, not knowing how long this is, going to last, how do we get those patients to actually start coming, back to us, so we don't have to do, deeper cuts, within our organization.
Is there going to be a huge surge? Like once people are comfortable, it's like, well, I've been putting off my dentist or my, physical therapy for months, and then there's going to be a huge surge in people. Are you guys trying to plan ahead for that at all?
We are, knowing once again it's a little bit different than maybe some of the other service industries out there where the restaurant is closed. I'm not going to double up on going to that restaurant on a day or a week, but for us, these people they need to see a physician, and now we've gone 4 weeks and maybe a couple more weeks that we are typically fully booked from an 8 to 5 of seeing patients, and now when you have this backlog of people, well, we can't be putting them off for weeks or months. We have to find ways to be able to see them pretty quickly. So I do see what's going to have to happen is we're going to have to expand our hours, and we're going to have to expand the number of days that we're seeing patients.
Has your job gotten more challenging, I guess, during this whole pandemic then?
It definitely has, and understanding, most people work within facilities, and when you tell those people you can't come to those facilities, but you need to continue to work, that means, that they need to work from home. And, if we look at what our healthcare organization did over the past, 3 to 4 years, we are actually in a better position for that. Over the past 3 to 4 years, we probably have about 70% of our customer service agents, their schedules that are actually working or have been working from home. So it made it easier that there was nothing we needed to do. I've been hearing a lot about, other organizations where they had to go out and make a huge procurement of computer equipment, technology to give to their workforce to work from home. So these are things, we're leveraging, the personal computers at people's houses, but still coming in, securely to be able to get to their business applications. It's one of those, we're in a very difficult time. So it's really difficult to kind of look down the road, but really important that we, take a look at what we are going through, some of the things that maybe weren't as effective or as efficient, up to this point. So this will force us to change our ways, and technology is not always easy, and people are sometimes resistant to take on that new technology. So change isn't easy, but something like this, when you kind of forced to take advantage of a video visit because you have no other option, that people become more comfortable with that and to be open to other ideas, that do come. But healthcare, has been, pretty inefficient. It's becoming, more efficient now. It's a big chunk of our paycheck, today, that, something, like this, where we can start implementing some of those efficiencies, through technology. I think we're going to see the results, the benefits of that, in the years to come. I'm hopeful that what we learn here is going to prevent this from happening or prevent it from spreading as quickly, as it did. That, that's what I'm hopeful for, that we're going to learn so much and implement so many different things that something like this will never, ever happen again.